覺原來我有面對3個問題。第一個問題咧，原來我發覺我今日個 talk 想轉做 Cantonese 原來真係唔係咁容易嘅。我發覺有好多 terminology 要用英文講係好容易，用 Cantonese 係好難。第二，我今朝早有時間去 rehearsal 做一次30分鐘。Oh, sorry. So I just came earlier this morning, and I find that I have difficulty to finish my talk in 30 minutes. That's another problem. And the third problem is that I'm the last speaker. So it's very challenging. So it doesn't matter. I try my best to finish my talk as early as possible. So my talk is about the AI-based computer-aided diagnosis for breast cancer detection. So I will cover a bit on the image segmentation, annotation, and clinical impacts. So my agenda will be split into 4 different parts. And the first part, I will give you an overview, very brief overview about AI. So basically, anyone who may not have any exposure before about AI, you will know a bit after my talk. And then I will talk about the clinical foundations. And luckily, we have Dr. Tan already introduced a lot of the foundation about the good use of mammography and also the 3D mammography. That will improve my speed of my talk because every important part already covered by Dr. Tan. And number 3 would be about the imaging segmentation and annotation method, which is the very core part of my talk. And then I will talk about several case studies, which would be used to support what are the significance of having AI in practice. Okay, so AI development. Basically, what AI can be used to predict something. Number 1, it can predict whether a disease is exists or not, number 1. Number 2 is to use the big data to kind of predict whether a disease prognosis is good or not, okay? Number 3 is to predict whether there's a treatment A, plan A, and plan B, which one is better, or whether these diagnostic method, A or B, which one will bring up a better diagnosis. So altogether, I think it's actually what our doctors doing, but in a better versions. So AI is to support our radiologists and doctors to make a better predictions. Okay, now it comes to the very difficult concept is about what is meant by computer-aided diagnosis, okay? So it starts from mammograms, our images, okay? From images, we collect all the image features. It's just like you are the doctor, you see over the films from this end to this end, extract all the important data, information from the image, and then you extract it using the segmentation method and annotate them with meaningful tags. And then end up you have a prediction whether the patient's got cancer or not. Now we have the AI. So AI, we have different AI models. And here is an example showing the AII, artificial neural network. And this is more complex in the sense that you insert all the image data into the first layer. And then in between the first layer and the last layer, there are hidden layers. And different companies won't tell you what are they. They have their secrets. But anyway, they are using all the image features and then fit into the AI model, and they will end up giving you a predictions, a percentage, whether the patient's got cancer or not. So, because AI can learn by themselves, meaning that if you give a lot of better data, it ends up you will have better outcomes, in a sense that you can give a better prediction. So that's why we now move towards using the AIs to support our predictions, right? So in here, you have, I highlighted 3 important parts in this chart. Well, number 1 is how we can extract those image features. And then how you use something to tag or label the image features with meaningful meaningful kind of meaning. And last one, before the image features can be extracted, we will use some kind of methods to process it before we feed into the AI models. All right. So for AI models, actually I have listed down here a lot of different models. For example, I just talked about the first two, logistic regression. Logistic regression is a base mathematical equations which has y equal to x, y, c, a, b, c plus everything add together or minus together, and then with different weightage. All right. So just like I use Cantonese to express this. 我今日食咗飯未？你估下？早餐。You make a predictions whether I have my breakfast or not. You can't guess, right? Because you have to ask me questions. But you cannot ask me whether I have breakfast or not, okay? So you use other angles to ask me similar questions. In the end, you can predict whether I have breakfast or not. For example, are you hungry this morning? Do you have money? Bring your money before you go to the restaurant. So all this indirectly provide the information, and then you can make a better guess. So this is the logistic regression. So you add all the components together in the equations. So some factor would have a higher weightage. Some factor you grade them a lower weightage. In the end, you will get a score whether I will have the breakfast or not. So this is the logistic regression, the how it works. And then decision tree is another very similar decision making process, which is an inverted tree, the shape of a tree, which start with, will I take breakfast today? And then it branch out with several subdivision. First of all, maybe 10% of chance I will take breakfast if I'm hungry. 10% of chance I will take breakfast if I got enough money. And then later in the second layer, whether if I confirm I will go for breakfast, and then the next questions will be which restaurant I will go. For example, I will go to Cha Chan Tan or to have dim sum. And then there's a decision tree from very first layer to the end of the layer, which is your questions, whether for example, in this case, whether the patients got cancer or not. So different AI models can be employed because of they are using a very similar gist as human thinking. So actually, we are using different AI models and embedded into our AI computer-aided detection program. And different models has different strengths, of course, because they can handle a different volume of data, and also they compute the results in different time frame. And training the data is very important because you use, for example, if you ask the same questions to someone who are living in Hong Kong and China, and then the same questions whether you will go to Cha Chan Tan in country like USA, you may not get the same predictions, all right? So that's why if you want to get a better prediction for breast cancer, you may have to use data collected from Hong Kong, China, as well as the Western countries, so that you can more holistic data to make a better prediction. So clinical foundations, I can skip this because our previous speakers already touched on this. Why screening mammography is very important. I highlight here is the microcalcifications, and only mammography can pick up microcalcifications. Ultrasound, CT, MRI, they have limited role. And that's why in the recent years, we have the 3D models of mammography machines, which can serve to to tackle the problem for those women who has dense breasts. I think you all know dense breast is actually a challenging task for radiologists to look at the mammography to interpret the image, because the dense part of the breast actually obscure the lesions probably. And if there's a case that the breast actually is very dense, we may use ultrasound and MRI to support radiologists to make better decisions. So that's why very clear with diagnostic value, mammography is very important. And if you get a very poor image quality, of course, when you fit into the AI model for training, what you get is a mess, right? So now we come to the image segmentation and annotation, okay? So probably all the guys here would be very familiar with this AI model, because your half, your better half, 你嘅太太、你嘅女朋友 will ask you these questions. 我今日有乜唔同？我塊面有乜唔同？ Okay, you will act like an AI and detect what are the image features from your better half, and then you say, oh, your eyes is having a different color corn. Okay, so you look very different today. So for AI, it's actually pick up all those differences, right? No matter it's a normal features or abnormal features, you let the AI to pick up those characteristics. So some of these are very easy to interpret. For example, you got lesions, you got the size of the lesions, shape of the lesions, whether it's very bright or dark. And then we get all this information and then extract it. So how to extract it? You have to segment. Okay, you highlight the region and then take it out. And then you take it out, you also have to label or tag what's the meaning of this, all right? So for example, you highlight a lesion here, and then you label it as whether it's a round shape or not, all right? So you give an index. And then on the right, image on the right is about the irregularity, whether the shape, the boundary of the lesions are actually regular in shape or not, and then you label it with another index. So in the end, there are a lot of work you need to label and highlight, right? And there are a lot of different annotation techniques available for you to help you to speed up the process, but end up you still have the entire process still have a lot of manual work. So that's why is causing the inconsistency, because someone who may consider the lesion is this big, but someone who may consider the lesion is just a little bit smaller than the previous observer, and that causing inconsistency. And if you put in the data which is wrong, then you got everything wrong. So what we call garbage in, garbage out for AI model. So now how to improve the image features extractions? We can do something before we feed the image into the AI models, like reduce the noise, improve the contrast. When we do the image registration between a series of different images, we can do some fine adjustment before we feed them into the AI model. And sometimes we have to make sure that the artifacts are not included in the AI model, because it will affect the accuracy of the AI process. So I will slightly touch on some of the very important pre-processing techniques that we are using. For example, noise, all right? So I'm not sure whether you know that image, radiographic image, that actually contain a lot of noise. It's just that with different level of noise. For example, you see this is a CT image of the abdomen, and you see on the right-hand side, that's actually the noise coming from the same image. So if we are able to eliminate all the noise, that will improve, of course, improve the image quality. But at the same time, if you doing over filtering, that will also eliminate some of the very useful information, all right? So that's a balance. Now, second, about the contrast. So the contrast is not just shifting up, shifting down about the slope, down the slope. It will improve the outline of the important organs. For example, you see the one on the left is not being processed, but on the right is the contrast difference is already improved. So a similar scenario is on my picture on the left-hand side is not processed yet. On the right has been processed. You can see the white straight line on my shoot. On the right-hand side, you can see very clearly, but not on the left side, right? So that's the power of the contrast. And then image registration, I think is very difficult concept because for different imaging modalities, we collect the image with different posture. So CT, between CT and MRI, our head will sometimes chin down or chin up a bit. So this is a variation between images collected from CT and MRI. So if you want to compare across a set of CT images and MRI images, then you may have to do something before you will fit into the AI models. And for those head and brain, they are rigid, fixed structures, and it's easy. But for breast, it's a soft lump. It will be challenging because when we put the patient on the table, whether it's a supine or prone, facing down, facing up, because of the gravity, the breast tissue actually will deform, and it makes challenging when we want to compare across images from CT collected from prone position or supine positions. So now I'm going to show you my earlier study is using the biomechanical factor to predict how the breast tissue and particularly the lesions will be deformed and move in the locations when it comes to different posture. And we find a very satisfactory results through this model. And of course, different pixel size have different pixels size or voxel size. So that's why when we do the measurements, we have to make sure that we may have to do the resampling or rescaling. Artifacts, all right. So this is a classical mammography image. On the left, we have the left-right marker on the image, and on the right, we already removed. So on the left side, with the marker, which is very dense, you can see that on the histogram on below, you will see the peak on the right-hand side. And if you remove the left marker, we actually remove the peak on the right-hand side of the histogram, and actually you can see all the distributions between the lower part and the upper part. So the range will be resumed. And this is about the standardization across different images. So images can be from different vendor. They collect even though the same images, but they have different parameters. They have different setting. So all this may have some certain implications to the final image quality. So we can do something to standardize across different images before we fit the image into the AI model. Of course, we have different technique to actually extract the information, what we call the region of interest. And here I want to show you, this is a very simple method, all right? So an image actually consists of a range of different brightness or grayscale, from very bright to very dark, all right? So let's say from 0 to 100, you want to make a clear cut and then convert everything on the image below or above certain threshold. Then you will make an image like this. On the far left corner, we set the thresholds, and everything will be only black and white. All right. And this method has been used quite often. For example, I show you here. This is the cells that we collected from microscope, and we are using different type of filtering, and you can see that actually the results actually are very different if we are using different filtering approach. So I highlight here is the method called the moments, and you see different filtering actually got different results in terms of segmentation. And this is how I used my picture, and using the same methods, different filter will have different presentation. Okay, so this is, I'm going to show you that the annotations process is very time consuming. Now I'm going to color all the area that belongs to the pulmonary artery, all right? So it's a very time consuming method to highlight all those patterns. Yeah, and another demonstration is to highlight the left ventricle. I will first highlight the left ventricle, and then the second part I will highlight the blood inside the left ventricle. And in the end, the first part minus the second part, what I got is the myocardium, which is the heart tissues within the left ventricle. So you can see that the process is actually very observer dependent, and actually it takes a lot of time. So I'm not doing very well because it's just to demonstrate the idea, all right? So in the end, this is the layer which corresponds to the myocardium. All right, so we also have to make sure that everything is in place very correctly, so we can check whether in the end that the image actually looks very similar to the original image. So we have the structural similarity index. So we can see that on the bottom right, there are two images. Actually, the similarity index are very low, and they are not very not exactly acceptable. And those on the top layer with a very higher similar index, they can be used for further process. So before we consider to fit all those preprocessed images into the AI model, we have to consider whether we are choosing the right imaging modalities. Because different AI models, they work perfectly for a certain image modality. All right, some are working well for CT, some are working well for MRI and mammography. You have to choose the correct one, and some of the AI model, they cannot accept certain type of image format. For example, some will also only accept the medical format, what we call the DICOM. Some can also accept the JPEG. And if this is a 3D, that's also causing a lot of problem because some of the software, they cannot, they need you to convert to other acceptable format before it can be fit into the system. Of course, when we do the AI, when we use the AI for training, we have to make sure that we eliminate all the image patient particular information before feeding them for training, because for the protection of the patient information and the identity. And also, of course, we have to consider the computational resources, whether it takes a long time to get the results is meaningless. And sometimes we will remove certain organs or structures before we put into the AI model. For example, here, this is the original MRI, and the right-hand side is the one without the skull bones, so that we fit the final image without the skull for better predictions. And also, there will be some measures to protect the patient identity. For example, here is to remove certain part of the face so that we protect the patient's identity. But at the same time, if you remove too many of the facial structures, that will affect the image registration as well. So it has to be with a good balance. So now it comes to what I want to present is that the annotation process is very challenging, right? And different observers may have different performance, and the task actually involve a lot of manual work and time consuming. This is the key message that I want to bring about for today's talk. And now it's come to the clinical applications. Now I share with you 3 cases. The first case is about AI, whether it is accurate. All right. So when you see the AUC curve, you see that the AUC curve on red is the one with AI, and the dotted blue line is the accuracy for cases without AI. So definitely using AI improved the accuracy. Okay. But the second thing I want to highlight is that it's not all the radiologists will consider this is useful. And you can see that the overall performance is improved. And for reader 8 and 9, you do not see an improvement. All right? So meaning that not all radiologists are benefited by using AI. And in terms of sensitivity and specificity, and similar trend observed. All right? And then second studies about the time to review the CAD, meaning that we provide the AI for the radiologists to review the information. So radiologists will have to spend extra time to review all the content. So actually the workflow, the time spent would be longer than expected. And actually the table 2 showing you that actually that will increase the chance that radiologists to recall the patients to retake. All right. And on the right-hand side of the table, you can see that I highlight in blue that one reader actually using AI would change his confidence. And sometimes it will increase the evidence, the confidence. But most of the time, it's actually reduce the confidence, right? So that's actually the two-sided error. Number 3 is about whether we can use the AI, other large language models to replace the AI. But you can see from this chart, the performance is far from the radiologist's performance. So the human can do better than the other large language models, such as ChatGPT. So in conclusion, AI-based CAD is good. It can provide contextual insights to radiologists. And in the future, we can combine more than one modality for the radiologists to make a better prediction, and also hoping that with AI, it can also help radiographer when we can doing the mammography screening, we can have very fast decisions using the AI support so that we can make on-time decision whether the patients could recall immediately after the screening process, the screening mammography process. So meaning that it will affect radiologists. Radiologists will use AI more frequent, and it will help them to release their workload regarding to repetitive tasks, and also all the times gain, they can use it for more complex cases, and also because of the more better predictions, they can use it as a personalized medicine, meaning that they can tailor-make the management for each individual patient. So I want to recap my takeaway. Number 1, AI is improving the accuracy, of course. Number 2, as you just heard from my talk, it has a lot of human interaction with AI. So I would proudly say that AI would not take up the role of radiologists. Instead, it will support our work, and we work hand in hand for the better of our patient. So that's all for my presentation. Thank you.